Hello, this is Dr. Stanley Lang, and welcome to this broadcast, which is answering the question, why are my fasting blood sugars still high? Which is a question that I get asked for patients who are in the process of trying to reverse their type 2 diabetes. And the question was raised again with the patient that was recently very successfully reversing her diabetes. She started the process not too long ago. And in a relatively short amount of time, her blood pressure has gone from the mildly abnormal elevated range to low normal. She's lost a significant amount of weight, and her blood sugars have dropped quite a bit, but they're still elevated a bit more than she's expecting as fasting blood sugars. So I explained to her that there are two major possible causes for this that will eventually fix themselves, and they are part of the defect of what's going on with diabetes in the first place. So the first thing that can be going on is what is called the dawn phenomenon. Now, this is something that diabetics experience anyway. Diabetics who are not in very good control and might even be on a lot of medication, which this patient is not. She's not on any medication. But they still experience that they have this higher blood sugar in the morning, and they're not quite sure why, because they didn't eat a bunch of food at night. And so what's going on during the night that would cause the blood sugar to rise? And so the dawn phenomenon is caused by a surge in cortisol production from your adrenal glands. It happens around 4 or 5 in the morning. And when that hormone starts going up, that pushes the blood sugar up. So for those people, their blood sugars are actually good during the night, and then they start to rise just before daybreak. And so the only way that you can tell if that's going on is to actually set your alarm clock, wake up at 4 in the morning, check a blood sugar, go back to sleep, then check your blood sugar again at 7. And if it's quite a bit higher at 7, then you know that this is the dawn phenomenon at work. The other thing that's going on with diabetics is that the liver gets confused about when to pump out sugar into the bloodstream. So the liver is a storehouse of energy that is called glycogen. So glycogen is this matrix of sugar molecules that are real concentrated, and water is part of that matrix. And when the body needs it, the liver pumps out this sugar from the glycogen stores. Well, the problem with diabetes is the liver has got a confused signal going on, and so it pushes out sugar when you don't need it. So with this patient that I was just telling you about, if she woke up and took her blood sugar at 4 in the morning and it was already high, and then at 7 it's still about the same, then this is the defect related to the glycogen release from the liver. Now, there is a medication called metformin which helps to decrease that process. But if you're doing the diabetes reversal program that we teach, eventually that part of the whole pathology will fix itself. So when it's a mild elevation in the morning, there's no rush to use medication to get it down. If it's quite a bit high, then of course using medicine for a little while until you have sufficiently reversed the diabetic chemistry that's going on might have to be done, and that's okay because it can be temporary, and then you can stop the metformin later. So this is a common problem. The blood sugars during the day might actually be looking great, but the fasting blood sugar is a little bit higher than it should be, and this is the reason why, one of these two reasons. So if that's happening, if you're in the process of trying to reverse and you're doing everything right, it will eventually fix itself given enough time and following the process. So hope you found this information helpful. God bless and have a great day.